Journey of an academician to a surgeon.
How has your journey been as an academician teaching students and then also as a surgeon with patients?
My aim is like academician is not only to teach them but to also make them as a good surgeon like me.
Invented new techniques to save his patients.
Are there any new techniques or procedures that you have invented?
Concomitant procedure. Suppose someone is having a coronary artery disease, that is the blocks in the arteries of the heart, and also blocks in the peripheral arteries like the artery which is supplying the leg. So I use a single conduit to cover the thing. That's my invention, I proudly say that.
NewsX India A-list proudly recognizes Dr. Durgaprasad Reddy for excellence in healthcare.
Hello and welcome. You're watching NewsX India A-list with me, Devika Chopra. Today we have a very special guest with us, Dr. Durgaprasad Reddy, a cardiothoracic surgeon. Sir, thank you so much for joining us on NewsX. I begin by asking you, Dr. Reddy, how has your journey been as an academician teaching students and then also as a surgeon with patients?
Yeah, thank you for inviting here. And my main asset is patience. So all because of my patience I am here now. So this journey was a lot of ups and downs. It was a rough road, it was a smooth road. It's very difficult to explain how is this, but one ultimate thing is the patients were being very trustworthy, and they trusted me so much that I could come to this level. So they made me to do more innovative things. They made me to get into all the toughest of surgeries, and that's how I'm here. And as an academician, I see everyday operating itself is teaching for my residents who watch my surgery, who assist my surgery. My aim is like academician is not only to teach them, but to also make them as a good surgeon like me. You know, that is what we aim at. I want all my residents, all my PGs, all my assistants to become like me to operate. That is what is our main aim. And of course, teaching students, you know, you keep yourself updated in this advanced world. And second thing is you also know what the young minds are thinking about it. So I think it was great, you know, teaching and doing surgeries, it goes hand in hand.
Right.
And I'm a prof, and it's well-being this way.
Also, at the same time, Dr. Reddy, what are your accomplishments, if you could shed some light on them in the field of cardiac surgery?
Yeah, this is my almost close to 25 years of cardiac surgery, and we have done close to 17,000 cardiac surgeries. I specialized mostly in adults and pediatric. I do everything. Like I do adult cardiac surgery, pediatric cardiac surgery, neonates. My least weight is around 1.8 kgs for a child, and you know, the ranges are different. That's mainly because we in a medical college, I'm a professor, we tend to do everything. So our team is geared to take up any kind of this one. And we also, you know, do a lot of thoracic work. You know, the lung surgery is what we call, and vascular surgeries, transplants. This is what it is. It's a good run. I've been in this medical college field from 2004. So we have done close to 17,000 cardiac surgeries. That's a great number, and all because of the trust what the management had on us, and the trust by the patients. You know, there's a saying, no point opening a shop without a customer. And the patients have been an important role in our treatment in our hospital field, and see, we greet our patients. They are our gods. So
Absolutely.
That's how we've been good here.
At the same time, sir, over the past few years in your medical profession, are there any new techniques or procedures that you have invented?
Yeah, see, we place in a very center of Bangalore, and the most surgeries what we get is all complex, rejected by some other hospital. This is what we get. So that made us to invent, you know, easier techniques and more advanced kind of things. Yeah, of course, our team has invented like what we call as concomitant procedure. Suppose someone is having a coronary artery disease, that is the blocks in the arteries of the heart, and also blocks in the peripheral arteries, like the artery which is supplying the leg. So I use a single conduit to cover the thing. That's my invention, I proudly say that. So we've been doing that for almost 50 surgeries. We have done that, and good results we have had on that. And we also, in congenitals, we made a lot of inventions, like we use single patch closures for something called as AV canal defects, and tetralogy blue babies, what we call. We had one of the largest series, like close to 1,000 surgeries, and I have also made, there's something called a transhandler patch we put. There's many like that we say. So we don't cut the valve completely so that we prevent this PR, what we call as pulmonary regurgitation. We leave the posterior and the lateral aspect of the valve. There's so many things like that. Every surgery is like, we find some new inventions to do that. Unlike other common surgeries and other things, whenever it comes to congenital and very complex adult surgeries, we plan ourselves and make our own kind of style of doing. And we've made a lot of papers on that.
At the same time, sir, I'm sure our viewers want to know if an angiogram is required for everyone, and if so, which category of populations should undergo the same?
See, angiogram is an invasive procedure. Of course, angiogram is a gold standard for understanding whether you need to do work on the coronary artery disease, that is, whether you need to do angioplasty, medical management, or a bypass surgery. So what I suggest is anyone above 40 years should undergo TMT test first as a routine every year. That is, TMT is treadmill test. You have to connect your ECG leads to your chest and make them run, and for 9 minutes, and if any changes are seen in that, suppose the TMT is positive, that's what we call, then we subject them for a sure angiogram.
Okay.
Or if the patient is only 30 years and has been chronic smoker, symptomatic, straight away go and do an angiogram and find out any blockades are there. Not all patients require angiogram, but angiogram is definitely a gold standard for understanding the coronary artery disease. A lot of tests have come, like CT angio, so many things have come, but we always, as a cardiac sciences, we feel that angiogram is the gold standard for understanding the coronary anatomy, their diseases.
At the same time, sir, in spite of being a very busy surgeon, we've also heard that you conduct a lot of camps across India. What really motivates you to do that? Oh yeah,
camps are my, it's like, going to, see, I don't conduct camps in towns, cities. I go to the interior parts of most of the parts of India. I used to go to Sri Lanka, Bangladesh, interiors of West Bengal, UP. I do camps because preventive cardiology, this is basically not to go and try to operate on them and other things. I've operated across country. So I go and conduct camps. Before camps, I give a small talk on preventive cardiology, and then conduct these camps, like I do screening echoes and ECG. Someone requires any kind of surgery, I get them to my place, that is Vaidehi Institute of Medical Sciences in Bangalore. The reason why we get there is because we are entitled for Arogyashri and also Ayushman Bharat, which is very good what our PM has done it, and all these patients can get, only reason is so that we can detect and pick up early diseases and treat them appropriately. Unless, I've seen so many people come to us with a very end stage and we try to operate, the results are not that successful. Always try to pick these people very early. That's why I do this camp. That motivates me to go to the interior parts and do camps and pick up these people so that we can give them the good life. That is what I believe in.
At the same time, sir, apart from serving your patients through your surgeries, we've also learned that you are a philanthropist. If you can just tell our audiences a little bit more about that.
Philanthropist, I'm not that great to explain what we do, because I really feel odd, what we do, we can't say this. We don't expect anything what we do. Okay. We do small things like any patients required surgery, we do most of them in free surgeries we do. We also donate 10 to 12 valves every month for poor patients, and children's, of course, they can live, they are our generations. So get them operated, they'll definitely going to survive for life, and so if they don't have any financial support, we support them fully to get their surgeries done. And other works like I do small works in village. I adopted 4-5 villages and I try to take care like water supply, electricity, roads. I built some small kalyan mantaps like thing so that they can get their selves, suppose you want to book a marriage, it's not that easy in this world. So I try to motivate these people to come and get their marriages and, like free water we give, roads we make, lights to the villages, street lights, all these things, apart from surgery, the joy of giving, I think one should understand that. That's
Absolutely.
what we see.
And sir, of course, I'm sure a lot of younger surgeons are also watching you. So what is your message to them?
Yeah, in this world, a lot of younger surgeons are there, and my advice and my request, I can't say it's advice, my request is most of the surgeons, they want to take simpler branches. They don't come into critical care surgeries like cardiac surgery, neurosurgery. They don't come into critical care areas. So, because they want to operate, they want to leave the hospital, they don't want to look back at the hospital. This cardiac surgery is like, it's like they need to be on their toes, always emergency, there's no margin of error. So, whenever there's no margin of error in surgeries, you need to be with the patients until he goes home. So, I always suggest, someone have to be very critical in treating these patients. So I always say this young surgeon should take up critical care areas like cardiac surgery, and so that it's a good branch, and you get a lot of satisfaction when you really cure a patient and send him home. That satisfaction I don't think you'll get in any other branches and other things.
Absolutely.
That's my thing.
And Dr. Reddy, before we let you go, sir, of course, we just like to understand from you your advice to the general population as well.
General population, this world, we have completely become, westernized in terms of food habits. You need to be having a healthy food, and we completely forgotten our traditional way of consuming food. And of course, smoking, most dangerous. You can't smoke. 3 cigarettes is enough to kill you. Nicotine will be present in our body for 8 hours if you're going to smoke. Smoking should be avoided, and alcohol, of course, your arteries becomes dilated, and the flow of the blood into the arteries are going to be slow, and that will clog your blood vessels. So heart attack is very common if you start smoking, unhealthy habits, and going to consume more alcohol. So advice is be healthy, exercise every day, and avoid these bad habits.
Well, Dr. Durgaprasad Reddy, thank you so much
Thank you
for joining us on NewsX India A-List.